In this video, we'll be discussing an essential medication often encountered in nursing practice, which is Valsartan. This medication is commonly used but can have significant effects on the body, requiring careful nursing considerations. Let's dive into its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Vital Nursing 101, your ultimate guide to nursing success. Starting with indications. Valsartan belongs to the class of angiotensin II receptor blockers, or ARBs, and is indicated for hypertension, heart failure, and post-myocardial infarction. Let's take a moment to learn about each indication now. Hypertension used to lower blood pressure and reduce the risk of cardiovascular events. Heart failure helps improve survival and reduce hospitalizations in patients with chronic heart failure. Post-myocardial infarction. Valsartan reduces the risk of death in patients who are clinically stable after an MI. Recognizing these indications will help you identify why your patient might be prescribed Valsartan. Alright, moving along, let's now learn about the action of Valsartan and how it works. Valsartan works by blocking the binding of angiotensin II to its receptors in blood vessels and the adrenal glands. This results in vasodilation, reducing vascular resistance and lowering blood pressure. It also decreases aldosterone secretion, leading to reduced sodium and water retention. These effects collectively reduce the workload on the heart and improve overall cardiovascular health. Adverse reactions. While Valsartan is generally well tolerated, it does have potential adverse reactions, including common side effects which are dizziness, fatigue, hypotension, diarrhea, serious adverse reactions which are hyperkalemia, elevated potassium levels that can lead to arrhythmias, angioedema, rare but life-threatening swelling, particularly in the face and airway. Renal impairment can worsen kidney function, especially in patients with pre-existing conditions. Monitoring for these reactions is critical to ensuring patient safety. Contraindications. Valsartan is contraindicated in patients who have a known hypersensitivity to the drug or its components, are pregnant. Valsartan can cause fetal harm when administered during pregnancy. Have severe renal or hepatic impairment. Are concurrently using aliskiren in patients with diabetes or renal impairment. Knowing these contraindications helps you identify patients for whom Valsartan may not be appropriate. Remember that as nurses, we play a critical role in ensuring the safe administration of Valsartan. Here are some nursing considerations. These considerations include assessment, skin checks, titration, and drug interactions. Let's take a moment now to learn a bit more about each. Assessment: monitor blood pressure and heart rate regularly to assess the effectiveness of therapy. Electrolyte monitoring: check potassium levels to detect hyperkalemia early. Renal function tests: evaluate kidney function through serum creatinine and BUN levels. Hydration status: ensure the patient is adequately hydrated but not overhydrated, especially in heart failure. Drug interactions: be cautious with concurrent use of potassium supplements, potassium-sparing diuretics, or NSAIDs, which can increase the risk of hyperkalemia or renal impairment. Your role is essential in preventing complications and optimizing the therapeutic effects of Valsartan. Patient education. Patient education is critical to ensure safe and effective use of Valsartan. Educating patients is vital for ensuring compliance and safety. Key points to discuss include adherence, Stress the importance of taking Valsartan as prescribed, even if they feel well. Blood pressure monitoring. Encourage patients to track their blood pressure at home and report significant changes. Avoidance of potassium-rich foods and supplements. Help patients understand the risk of hyperkalemia. Signs of adverse effects. Teach patients to recognize symptoms like swelling, severe dizziness, or difficulty breathing, and to seek medical attention promptly. Pregnancy risks. Advise women of childbearing age to use effective contraception and inform their healthcare provider immediately if they become pregnant. Remember that clear and concise education promotes better patient outcomes. Valsartan is a cornerstone medication for managing hypertension, heart failure, and post-MI care. By understanding its indications, mechanism, potential adverse reactions, and nursing considerations, you can play a crucial role in ensuring safe and effective therapy for your patients. As nurses, your vigilance and patient education efforts are critical to optimizing care and preventing complications. All right, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. Also, if you have any study tips, leave them below. I'd love to hear from you.